The first thing you'll do when you come into the infusion center is get registered. When you come through the doors, the registration is on your left. You're going to be registering every time you come. In registration, they check to make sure that you're on the schedule. They check your insurance to make sure that everything is okay, and then they send you back to the oncology center. The nurse or the tech will come out to the waiting room and get you. Every time you come to the infusion center, you're going to get your weight, and that's for a couple of reasons. The first is that your chemotherapy is dosed precisely based on the weight that you are that day. The next thing that we want to know about your weight changing is maybe if you're not eating as well, or maybe you are retaining fluid and you've gained some weight. When you come back to the chair that you're going to be in, you'll be in a chair kind of like this, a recliner. You'll be out in an area with other patients, but if you need more privacy, we have curtains that we can draw to give you more privacy. The next thing that we do is get your blood work. If you've got a Mediport, the nurse will access your Mediport, and we can get your blood work from that. If you don't have a port, you'll be getting an IV placed. That's also where we'll infuse your chemo from. We'll get your vital signs and make sure that everything is fine with that. Your heart rate's not too high, your blood pressure's not too low, and make sure that you're stable for chemo. Once the nurse sees that blood work and makes sure that everything is okay, then she takes your order back to the chemo pharmacy. They don't mix any of your chemo before you get here, because if you were to come and maybe you had too many side effects, or you weren't feeling well that day, or your blood pressure was too high, or any of those things that might happen, or maybe something in your blood work was off, the doctor might decide to not do your chemo that day for some reason, or they might decide to reduce the dose or something like that. If the pharmacist had mixed your chemo ahead of time and then we changed it, or you didn't get it, they would have to toss that chemo. There's a TV at all the chairs. You can bring whatever you need to make you comfortable. We have drinks and snacks. You're able to bring whatever you want to with you as far as food. We have a microwave and a refrigerator for you to use if you need that. You can bring your own computers. People bring tablets. Some people like to do work. You'll also be getting some pre-medications. These are medications that we give you in order to make the chemo better tolerated and to also preemptively take care of some side effects that we might know that you're going to get. Everybody will be getting some nausea medication, whether in your IV or in a pill form. You'll always be getting a bag of hydration. That's just fluids. One of the biggest questions that people have is, how long am I going to be there? It's always different for everybody. The last thing you do before you leave here is make your next appointment. And that's pretty much your day at the infusion center. We do our best to keep you comfortable and keep you feeling well while you're here.